Morning. Today we'll be discussing on the topic ethical principles. So dental profession is a vocation in which knowledge and skill is used for the service of others. One of the characteristics of a profession is adherence to a code of ethics. Being a healthcare provider, it carries with it a responsibility to individual patients and the society. The special status that society confers on the professionals requires them to behave in an ethical manner. Ethics is derived from the Greek word ethos, meaning custom or character. Ethics is a philosophy of human conduct, a way of stating and evaluating principles by which problems of behavior can be solved. Ethics is concerned with standards, judging whether actions are right or wrong. So now let us discuss about the ethical principles. Most importantly, there are 6 ethical principles. The first one is to do no harm. It is also known as non-maleficence. Second is to do good, that is beneficence. Respect for persons, justice, veracity, also called truthfulness, and the last is confidentiality. So now let us think about non-maleficence. To do no harm or non-maleficence is considered to be the foundation of social morality. So iatrogenic disease is a name that we give to doctor-induced illness. And all of us in the dental field have seen overhanging restorations which cause periodontal disease or failure to sterilize instruments which may cause an infection. So whenever a patient comes to us, it is mandatory that we should not do any harm to them. We should always be careful so that we do not cause any harm to the patient. The second principle is beneficence. To do good or beneficence is required of all healthcare providers. It should be the role of dentists to benefit patients as well as not to inflict harm. The expectation of the patient is that the care provider will initiate beneficial action and that there will be an agreement between the doctor and the patient that some good will result. So whenever a patient comes to a dentist, the patient may think that something good will happen and the patient would like to have a solution for his problem. So whenever a patient comes to us, it is our duty to do a proper diagnosis and give a proper treatment and also advise them if they have any other health problems. So these are all part of being good to the patient. So the next principle is respect for persons. This incorporates at least 2 fundamental ethical considerations. One is autonomy and the second is informed consent. So autonomy dictates that healthcare professionals respect the patient's capacity for self-determination in making decisions regarding their treatment, and informed consent is an essential component of a patient's right to autonomy. So what is autonomy? Autonomy is a principle that dictates that healthcare professionals respect the patient's right to make decisions concerning the treatment plan. Patients should not be bystanders in their treatment, but they should be active participants. Dentists sometimes attempt to direct a patient toward a particular mode of treatment by stressing certain advantages and not mentioning the disadvantages. It is a breach of ethics to mislead or misinform patients. In addition, it may well become a legal problem. So you always have to inform the patient regarding all the processes in the treatment and all the alternatives, all the advantages as well as all the disadvantages. Dentists are often trained in a paternalistic setting and therefore practice in a paternalistic way after graduation from dental school. So what is paternalism? Paternalism meaning to behave like a father. Usually in our house, father takes all the decisions. Similarly, sometimes the dentist take all the decisions for the patient. When a patient comes to us, you tell them, this is your problem, this is the treatment and you have to do this. And usually people don't ask them, these are the options, which do you want to do? Okay, so behaving in a paternalistic way is not an ethical way of patient management. Paternalism in healthcare can take the form of withholding information, restricting choices, or making the choice for the patient. You should always allow the patient to take the decisions. Under this principle, the dentist's primary obligations include involving patients in treatment decisions in a meaningful way, with due consideration being given to the patient's needs, desires and abilities, and safeguarding the patient's privacy. The patients are provided with relevant information such as different modes of treatment, their risk, their benefits or consequence or of not availing the treatment, any alternative modes of treatment, etc. So next is informed consent. Informed consent is both a legal and an ethical concept, and it is an essential component of a patient's right to autonomy. Informed consent is the first stated and the largest principle of the Nuremberg Code. So what is the Nuremberg Code? So after Second World War, the Nazi Germany army took so many people to their concentration camps, and they conducted so many tortures or experiments in these people, and thus it was taken to the court, and that was known as the Nuremberg trials. So as a part of the Nuremberg trials, the court gave 10 codes of principles which are known as the Nuremberg Code. Okay, so this gave more importance to the informed consent process. So Nuremberg Code identifies 4 attributes of consent without which consent cannot be considered as valid. So consent must be voluntary, it should be legally competent, it should be informed, and it should be comprehending. So we should not force somebody and ask them to participate or ask them to undergo the treatment, but it should be voluntary. And it should be comprehending, it should be in an understandable manner to them. We cannot use medical terms and complicated terms which the patient may not understand. The informed consent is a 2-step process. First, information is presented to the patient by the doctor. Secondly, the patient satisfies himself or herself that he or she understands, and based upon this understanding, either agrees or refuses to undergo the treatment. So next principle is justice. The primary duty of the health professionals is service irrespective of class, creed, religion, etc. It is often described as fairness or equal treatment, giving to each his or her right or due. Justice demands that each person be treated equally. The principle of justice calls for an obligation to protect the weak and to ensure equity in rights and benefits, both for groups and for individuals. So here we have to think about 2 terms. One is equality and the other is equity. Most of the times we use them interchangeably. But what is the difference between these 2 terms, equality and equity? In equality, you are providing everything equal to all the people. But in equity, you give to people who are in more need. Here in this example, the tallest kid can see the game very clearly. The middle guy can see at his height, but the small one, the youngest child, is not able to see the game. So in equality, you provide all the 3 with one stool so that they can watch the game, but still the younger kid is not able to see the match. So but in equity, you see that the smaller kid is given 2 stools, whereas the taller guy is not given a stool. So here you are giving to people who are in more need. So that is known as equity. So you have to be familiar with these 2 terms, equality and equity. Next is truthfulness or veracity. The patient-doctor relationship is based on trust. Lying shows disrespect to the patient and threatens the relationship. So even if something wrong happens from our part, it is our duty to inform the patient what has actually happened, so that the bond between the dentist and the patient is not affected. The dentist may feel that it would be better if the patient took a certain course of action and therefore manipulates the information that is given to the patient. Whatever the reason, the relationship will ultimately suffer and the dentist will be guilty of transgressing a major ethical principle. So whatever is the reason, it is always our duty to inform the patient what has happened, and you should be truthful to the patient. The last principle is confidentiality. Patients have the right to expect that all communications and records pertaining to their care will be treated as confidential. Earlier, it was widely accepted that confidentiality could be breached if it was thought it would benefit the patient. But now the patient's permission has to be sought. So it is human nature to reveal personal information about others to some other people, to a third person. So if a a celebrity comes to a clinic, he may share his personal matters to us. It is human nature that we may share it with somebody else, but it is a unethical practice. So we should always keep things confidential regarding the patient's information. We are supposed to reveal the information regarding the patient to the court when there is some emergency, when there is some court order, or if the patient is having some disease like HIV. In that case, we can inform his spouse or his partner for as a warning symbol. Okay, so otherwise we are not supposed to reveal the patient's information to a third person. So these are the ethical principles. Thank you.